At Progressive Sports Medicine, longevity isn't just about living longer, it's about helping our patients live well. And emotional health is a core pillar of that. Just as we assess your heart, muscles, bones, metabolism, we also assess how your nervous system and mind are coping. Now, this isn't about labels or diagnoses, it's about making sure we don't miss something that could quietly undermine your health, motivation, or progress over time. It's important to understand that chronic stress, low mood, anxiety, and loneliness don't just affect how you feel. They directly influence inflammation, insulin resistance, sleep quality, cardiovascular risk, and even how well you recover from injury. From a longevity perspective, emotional health sits upstream of the many conditions we're trying to prevent. And this is the body-mind connection in action. We as a society really need to break through the stigma around mental health to understand that being our emotional best is more about biology. It's not a personal weakness, and certainly not a mindset failure. Large population studies show that chronic loneliness and psychological distress come together, and they carry mortality risk comparable to smoking and obesity. And that's why we should take emotional health just as seriously as blood pressure or cholesterol, even when everything else looks good on paper. It's not just about being happy all the time, it's about reducing long-term biological stress on the system. And the way to view this, I think, more healthily is as nervous system overload. Most emotional health issues we see in high-functioning adults are not psychiatric disease. They're overload of the central nervous system. Poor sleep, constant cognitive load, lack of recovery, underfueling, and relentless responsibility push the body into this chronic fight and flight mode. And we're just not designed to live there continuously, but modern life keeps us there. When that happens, motivation drops, consistency suffers, and joy disappears. And these are very important influences that have downstream effects on our physical health and function. But the cycle is modifiable. We can be proactive in reducing chronic sympathetic nervous system activation, that so-called fight and flight response, with practical, individualized strategies. And you can see these contributors to persistent fight or flight response on the left, the stresses, sleep disruption, poor recovery. All of these things here increase the inflammatory and hormonal cascade in the middle, and the physical and psychological effects are here manifested on the right. It's about regulation of this chronic sympathetic nervous system activation. So the feedback loop we really want to break is this loop here. Emotional distress makes exercise, nutrition, and sleep all that much harder. When those slip, emotional health then worsens. So there's an interaction, and our job is to identify where that loop is breaking and intervene at the right point with the right professional support. And using these strategies, including mindfulness and other intentional behavioural inputs here, we're giving the nervous system an opportunity to reset so the rest of the health plan actually becomes achievable. So what tools do we use in our process, and how do we check in? Well, one physiological tool we sometimes use is called heart rate variability. And this reflects how the autonomic nervous system is functioning. When stress levels are high and recovery is poor, the normal beat-to-beat variation in the heartbeat reduces. And we see that this can be a helpful signal. Of course, it doesn't replace the important measures of checking in with how you're actually feeling, functional testing, and certainly daily coping questionnaires. But the goal is to help us all work on strategies to help move us away from our primitive central crocodile brain parts, like the amygdala, which pushes up emotional reactivity, and toward using our cerebral cortex, which is where we control how we react to stresses and lead a more emotionally intelligent lifestyle. So although this is improving, there still is stigma around psychology and mental health. But psychology isn't just about crisis management. It's a professional service that teaches us skills for emotional regulation, stress tolerance, identity, and resilience, the very traits that predict long-term success with health behaviour change. One of our key goals is protecting motivation. When emotional health isn't supported, people often blame themselves when the plans don't stick. We can be proactive about this, and I like to think of regular psychology input as healthy check-ins. It's like emotional health training and fitness. Just as you do your strength and aerobic work, you work on strategies to keep your mind in its best shape too. These regulation strategies and supports are critical to help us sustain health behaviours over decades. In sports medicine, the best analogy is the so-called central governor, and that's a term coined by Tim Noakes in his research on the physiology of fatigue. He discovered that it's not lactate accumulation, it's not lack of fuel for our muscles that drives fatigue. First and foremost, it's the brain and spinal cord, our central nervous system, that decide when we call it quits, not the physiological pathways. When emotional health improves, consistency becomes easier, and people are far more likely to maintain exercise, nutrition, and recovery habits in the long term. So here's how we approach emotional health at Progressive Longevity. We use brief, validated questionnaires to start with to understand whether there's anxiety, low mood, and distress, not so much to diagnose, but to guide support. Most people fall into a mild to moderate range where targeted strategies can make a dramatic difference. Our focus then is identifying modifiable patterns and working together on practical steps to create stable conditions for long-term success. We work along psychologists and psychiatrists when needed, while continuing to support physical activity, sleep, and metabolic health. And this avoids the all or nothing trap, where people feel they have to fix everything before they're allowed to start. You don't need to be perfect to make progress. And this is a really important concept that we refer to as Joyspan. I think we need to acknowledge that this whole process also has to be about being happy. And happiness is at the core of leading a fulfilling existence. The term was actually coined by Dr. Arthur Brooks. He's a social scientist at Harvard. He was looking at depth of enjoyment, meaning, and connection experienced across the lifespan, not just the length of people's lives. And he wanted to understand quality of life honestly, and so do we. We want to look beyond the physiology alone. So the analogy I often use is this. We think of the body as a high-performance car or a hot rod. If we can build a powerful engine, we can build strong muscles, good fitness, excellent metabolic health. But the longevity part isn't just about building the car. It's about taking the car out into the world, having a direction to travel, people to travel with, and reasons to enjoy that journey. And that's the why of all of this. It's the purpose and connection, not just the physical capability. Longevity isn't about perfection, it's about sustainability. Emotional health determines whether the rest of the plan actually works. Our role here is to determine and identify the right level of support so you can keep moving forward, physically, mentally, and emotionally in the long term. This content is provided for general educational purposes only. It is not intended to be medical advice and does not replace consultation with your own doctor, psychologist, or treating health professional. Emotional and mental health concerns vary between individuals and should always be assessed in the context of personal history, symptoms, and circumstances. No doctor-patient relationship is created by viewing this content. If you are experiencing persistent distress, mood changes, anxiety, or thoughts of self-harm, please speak with your GP or a qualified mental health professional or seek urgent medical support if required.